Hello everyone, welcome to my another new video. Today we will learn how to perform oil visualization. So first of all, the three types you are seeing on the screen. This is the localizer image, the first image, this is the sagittal image, this is the coronal, and this is the actual. Now we will now give the T2, STI and sagittal plan. So the sagittal plan will be coronal and above 1 year following the anatomical position, we have given the sagittal plan. Now we will give the coronal slice. The coronal plan will be and above the sagittal plane. Look, in this area, we are observing the pathology at 1 o'clock. Okay. Let's increase the distance a little. Okay, following the anatomical position, we have nicely set the coronal plan. Okay, now on to another plan. One axial, so the axial plan will be coronal and above the sagittal. We have followed the anatomical position and set the planning very nicely. If I talk about the parameters, here the slice thickness is 5 millimeters and there are 27 slices. Since we will be pushing contrast for this patient, the contrast will only be given in T1 or needs to be given. So here, as you can see, there are several axial T1, sagittal and coronal images. So this T1, we will just copy it over the normal T1 that we have. We copied it and applied it. Okay, we set it to 200. Now let's finalize the image and apply it. One axial was set for planning. Now the sagittal T1 sagittal is there. License is region. Now apply. And coronal. When these images, that is these sequences are finished, then we will do the post contrast. To assign the task, we will write the agent here and we will drag and drop the post contrast and volume here. Okay, now continue. Please pay attention to the images after giving the contrast. Here we can see a pathology at 1 o'clock. This is the sagittal image after contrast was given. And in this area, we are observing the pathology right here. Thank you so much.